Hello and welcome to this virtual town hall on COVID-19 brought to you by the cities of Farmington Hills, Farmington, and Beaumont Hospital. I'm Lauren Turner from the City of Farmington Hills Video Division, and I'll be your moderator today. Now, over the past week or so, we've received some emails from community members via email. Today, we're going to focus on those key topics that were brought up from those questions. You can also email us during this discussion to covidquestions@fhgov.com. A full recording of the town hall will be available for you if you've missed anything. And to answer your questions today, we have a panel of wonderful experts in their respective fields. Panel, I'm going to have you each introduce yourselves. We're going to start with Farmington Hills Fire Chief Unruh. Take it away.
Well, thank you, Lauren. I've been a firefighter paramedic for the last 35 years, with the last 5 of those being fire chief for the city of Farmington Hills. I want to thank you for the invitation to be a part of this very distinguished panel this evening.
And whoever wants to go next can go.
I'll go next, Lauren. My name is Ted Worthman. I'm the Director of Public Safety for the City of Farmington. Been with the department 24 years and been involved in firefighter and EMS for 27 years. Excited for the opportunity to be part of the panel.
Hello, I'm Dave Clays. I'm the president of Beaumont, Dearborn, and Farmington Hills Hospitals. I'm really thankful to be here, especially with this group of individuals. I really appreciate all their hard work. And I've been with Beaumont for about 15 years. I've been at Farmington Hills for the last 2 years.
Hi, I'm Dr. Mike Reback. I am a general and trauma surgeon. I've been at Beaumont Farmington Hills for almost 30 years now, and I've been the chief medical officer there for the last 5 years. And thank you for inviting us for this panel discussion.
I'm Dr. Wiley Fan, who's an infectious disease. I was here before Mike started, so maybe about 30 years or more. In the previously called Botsford Hospital in the community there. My primary role at the beginning was just infectious disease, more recently patient safety officer and other job duties that don't really apply here. But the main focus obviously around this is about COVID. So, and I've been serving here at Farmington Hills related to and trying to steer us through this pandemic, working with Mike and Dave, and certainly that's been an adventure, but it's been very, very fruitful, and very appreciative of the team that we have out here in Farmington Hills.
Thank you. Just on behalf of the whole community, we really appreciate each of you being here. And we are going to get to the questions that were specifically sent over from our community. But first, I have a few questions that I think all of us probably want to know the answers to. Let's talk about the new variants. How big of a concern are they, these new variants of COVID-19? And is it making people sicker than the first strain? Anyone can answer that, whoever wants to.
Well, I'll take that one for you. The basic issues with the variants is the fact that we have identified specifically the one that is really concerning us the most is the UK variant. It does seem to be much more transmissible. It does look like the recent data out of the UK indicates that it has caused about 30% more fatalities, whether that's specifically related to the type of patients or whether this virus is actually a little bit more challenging for those patients. We're not sure, but at least from the outcome perspective and the severe version of it, which has caused people to expire, that does seem to be true. So, however, the good news on the more infectious is the fact that it has not really affected much in the way of vaccine. So that is a very good thing, and it does not. And because of the fact that it's only an isolated mutation, it does not seem to have affected any of the monoclonal antibody therapy either. The more challenging one that we've just recently identified in South Carolina and Maryland is the South African version. That one is a little bit more concerning because it's a group of mutations. And these are mutations that are situated prominently in the spike protein, as well as a little bit part of the entire complex. So there's some concern about efficacy of the monoclonal antibody. And I think you probably have recently heard in the press that the new vaccine that's coming out with the Johnson & Johnson version, they have actually tested their vaccine in a group of South African community, and does not look like the vaccine is as effective as we'd like to have seen it. But there is good news. If we're going to talk about the J&J vaccine later, I can follow that up a little bit more.
Yeah, I'm sure we will get to that as well. And just speaking of these vaccines, people are always asking, how safe is it? Is it safe enough where it makes sense to get it over potentially getting COVID?
Right. So this is one for me again, right? So the answer to that is that I think everybody's been thrown off with all the rhetoric about how fast and the warp speed and stuff. I think we're all taken aback a little bit about speed with which it was developed and into the market. And I think with some of the mistrust that has been, floating around in the community, not only for how things were handled, but also for the big pharma side, right? I mean, we're talking about pumping billions of dollars into big pharma to kind of develop these. I think there's always somewhat of an innate mistrust for that, and that was even pre-pandemic. So I think those two are kind of the driving force, I think, at least in the majority of the hesitancy part. But I think the main thing is that we have now vaccinated millions of people. And if you look at the bottom line safety of it, it's been interesting that we've only had about 10 cases of true anaphylaxis, given that we've administered, millions of doses already. And it looks like the rate is really low. I mean, it looks like it's about 1.3% or 1.3 percent in the, or 1.3 cases per million. And that's really a low number. And so it actually seems to be more safe than most of the traditional vaccines have been, actually, especially for the allergy side. Now, there is a couple other minor things that we are tracking, but to be honest, I mean, it's really a very, very clean vaccine in the sense of how it's manufactured and what the ingredients are.
Okay, so it sounds promising. Let's go from a local perspective. Chief, you may want to take this one. So how has COVID-19 impacted local fire and police in the Farmington and Farmington Hills communities?
So in late January of 2020, the conversation and the media coverage of COVID-19 started to pop up on our radar. Internal conversations took place at the fire department. We looked at our preparations and how we responded to Ebola in 2015, our last big response to anything in any preparation. We still had a very small cache of personal protective equipment. We knew we lacked proper quantity of respiratory protection. So we went ahead and immediately placed an order for several N95 masks with our suppliers, several hundred. And these were ordered to protect our firefighters and also our police officers. Within 48 hours of placing this order, they were unavailable nationwide for first responders. During the month of February, we continued to search out and acquire other forms of respiratory protection, eye protection, shields, coveralls, sanitizers, to make sure that our ambulances were sanitized after each call and to make sure that our police and fire stations also received the proper cleaning on a routine basis. We created policy and procedures on how to respond to potential COVID runs, which involved protecting our staff, minimizing the number of staff that could come in contact with someone that's potentially infected. We then sat back and waited. We were very hopeful that Michigan and specifically Farmington Hills would not be impacted by COVID-19. However, as we remember, the first 2 cases of COVID-19 were announced on March 10th. Locally, we started to see what we call presumptive positive patients in the Farmington Hills area on March 19th. These are patients that had the signs and symptoms of COVID-19, but lack that positive test, mainly due to testing not being quite as prevalent early on. Our call volume for COVID patients quickly ramped up. Normally, in a 24-hour period, we respond to about 29 calls. We quickly experienced 40 and 45 calls per day. What's notable about this is from the standpoint that our daytime population was extremely diminished due to the statewide shutdown. So to summarize, to date, we've treated and transported over 800 COVID patients and responded to approximately 70 COVID deaths. Our busiest day was April 2nd, when we responded to 48 calls in a 24-hour period. And then we started to experience a more normalcy. Our calls started to return to a more normal level about the end of May, and it's pretty much maintained that normal level since then, with an occasional COVID call here and there.
Okay. Director Worthman, did you want to add to that?
Yeah, if I could. Chief Hunter did a great job of explaining what we expected. And here in Farmington, what we saw was about a 15 or 20% increase in run volume in the months of March, April, and May, and then it flattened out through the summer months. And we were all gearing up for what we call the second wave. And fortunately, our run volume has stayed, much like Farmington Hills, pretty flat. Occasional COVID run here or there. And I also wanted to give a shout out to Oakland County EOC. They did a wonderful job of keeping us prepared with PPE, and the communication between the departments in Oakland County and Oakland County EOC was great.
Wonderful. So one of the biggest questions we've gotten is, where can you register for the vaccine? Is there a hotline? Where? So I don't know who wants to take that one.
Sure, I'll take that one. So if you go on the My Beaumont chart, there's a website. If you're already in the My Chart electronic medical record system with Beaumont, then you can go in and access your chart and potentially get an appointment for the vaccination or to register. What we found, though, that was our plan initially, because we've been a little bit restricted in the number of vaccines that we get. We still want you to do that. Great. If you don't already have a My Beaumont chart, we want you to go ahead and do that. And we'll get that exact information out on the link out. We'll go through the city to get that out. But what we've had to do is go to a lottery where we go through and based on the most sick patients in the system, we select those patients, and then we go through and do a randomized people over the age of 65. We go ahead and do a lottery to go ahead and select those individuals for one of the three sites within Beaumont, either at the Dearborn Hospital, at the Southfield Corporate Services Center, or at the Troy Hospital. And we could do somewhere between 2,000 and 3,000 patients a day there, just depending on the amount of vaccine we get. We've kind of been limited a little bit. We've been doing right around 5,000 or 6,000 vaccines a day, but we definitely want to get more vaccines so we can get up to our maximum around 9,000.
Okay, and with the new variants that we were talking about of COVID-19, how effective are our current vaccines? And I guess Dr. Fan can take this. The current vaccines, and you can talk a little bit about the Johnson & Johnson, that one single dose one as well.
Right. So as far as the efficacy goes, right? So we know that the single mutation, in the UK version is just a single mutation. So it looks like that the tests that are being done, now they have not published this data just yet, but the word out of Moderna and Pfizer is that there probably is a very minuscule or very small reduction in the efficacy. So there is not an expectation that they would have to need to change the vaccine at this point. Now, the Johnson & Johnson vaccine is a different type of vaccine. It's a viral vector vaccine, and that would be a little bit more challenging to change that. But there is a reduction in its efficacy in the South African version of that virus. So there, the efficacy is lower. However, if you just dig into the weeds, now we focus too much about the numbers, right? I mean, 90 and 94 and 95% of the RNA vaccine is a really high number. But when it comes to the Johnson & Johnson vaccine, it looks like in the United States, it's about 72% efficacy in preventing disease, especially the moderate to severe version. And then when you look at the South African, it dips all the way down to about 49%. Now, the good news through all of that is that it's effective across the board in preventing severe disease. So if you looked at the vaccine from a moderate and even a mild illness, it may not prevent those as well. I mean, that part of it is maybe a lower number than the 94%. However, if you're getting disease that's milder, then that's a huge win, especially if you knock out the top part, which is the severe to the fatalities associated with COVID, then that's a huge win. So really, these numbers are very encouraging for a viral vector vaccine, especially one with a single dose. So the trade-offs of the single dose versus it preventing fatalities is a huge, huge win. So we're actually very happy with the performance of that vaccine just as well as the other one. So I think that because we need more vaccine worldwide, I think this one I think will quickly become EU emergency utilization approved as well as the other vaccines.
Okay. Now, if you've had COVID-19 already and recovered from it, do you still get the vaccine?
Yes, you do. Okay, so the emphasis there is the fact that there is this immune response if you had COVID. Now, unfortunately, when you look at those patients that have had COVID, you have to assess what is the likelihood of that person having enough antibody in their system to protect them over time. So if you have, the milder the cases you have of the COVID, the less likely you'll have high enough antibodies sustained over a long period of time to protect you beyond that point. So the fear, of course, is there a benefit to vaccine in addition to the natural antibodies you may already have? And the answer is, in order to get you to a protective level of antibody, the best way to do it is also to get vaccinated. Now, we tell people that if they recently had COVID, there's no urgency to get it. So, if you want to wait a bit, that's okay. However, there's no downside to go ahead and getting the vaccine whenever you can obtain it. So it is a boost to your natural immune system, even if you had it. So we do encourage people, even if they had COVID, to go ahead and get the vaccine.
Okay. And do you know any of the doctors can take this, the infection rates in our community, specifically the Farmington Hills, Farmington community? And I guess out of those infection rates, how many were hospitalized? You guys have that?
Dave, are you I know that you had some city data at one point, but do you have Farmington and Farmington Hills?
Yep, I do. So in the peak of COVID, we were seeing at Farmington Hills back in March and early April around 130, just below 140 patients in the hospital. It was about 75% of our hospital. So each day that was kind of the census there for probably about 6 weeks. That dropped down really low. We had anywhere from 5 to 10 patients a day, pretty much through June, July, and August in the hospital. We saw this peak up to around 40 here in the second surge, maybe 45. We were getting a little bit nervous because it starts to strain the hospital when we get a big number. That has come down nicely through the holidays and with the stay-at-home orders. Today, I think we had 13 positive patients and 18 total. So that was kind of where we at with COVID for Farmington Hills. And then today, I think we have in all the hospitals of Beaumont, that's about 2,500 hospital beds. We have in total about 200 patients in the health system for having about 40% of the hospital beds in Metro Detroit.
Okay. Another vaccination question. Once someone is vaccinated, Do they still need to avoid close contact? Still wear masks, social distance, etc.?
Yeah, the answer to that is yes, and the main reason is because when you're looking at these vaccines, there's goals and there's goalposts for these, right? So one is to prevent infection. The other goalpost is to try and decrease transmission. So the component part of that is we clearly understand how well these vaccines are preventing illness. What we don't know yet is all the data on the transmissibility part. So the question then becomes, if you're vaccinated, can you still transmit? So if you were to get COVID, so if you're taking the vaccine and you know that none of these are 100%, so if you had COVID, it could easily lead to a very mild illness that you may misinterpret as having COVID. You may interpret it because it modifies the course of the disease quite significantly. So therefore, the question then becomes, could you still transmit if you have COVID? And two questions would be if you have mild disease and transmit, or if you actually develop asymptomatic disease after vaccinated and still be able to transmit. Those are two questions. That question is unanswered. So for now, the recommendation is you still should distance and you still should mask. And then the extension of that later on, which no one asked, but the question would be, how does the variants and the new mutations affect that kind of issue going forward as we continue to develop vaccine and then the virus continues to mutate? Then some of those questions may have to be re-looked at or re-answered.
Yeah.
So it's really to protect others and make sure that you're still doing the right thing about not only protecting yourself, but really about protecting others.
Awesome. Say that again. Protecting others,
Protecting
yourself.
others, right, exactly. We need to
Okay.
It needs to be protecting others first.
Right, exactly. We're getting into some questions that are specifically from our community. They've emailed us. We'll start with Erin L. So she says, given the increased transmissibility of the new variants, is there any effort by the city to secure more effective PPE for our first responders, essential workers, and community members?
Chief, I'll take this one.
Okay.
Like I spoke about before, we were really lucky to have good communication with the Oakland County EOC and our other partners within the county. We had all the PPE that we needed. Chief Unruh talked about N95 masks. We got those right away, got everyone fit tested to make sure they fit properly. And then what we did was we followed a lot of the CDC suggestions, social distancing, trying to limit our exposure time, washing our hands. We had a procedure here at the station to clean every hour, and we were really fortunate, at least in the first wave, that none of us directly got sick with COVID-19.
Okay, now this question is from a Farmington Hills City Council member, Jackie Bolaware. She says, many seniors believe it's too difficult to obtain a vaccine if the primary way to get on the list is through online access. Some don't have a comfort level with inputting data online. Further, regarding Beaumont's My Chart, many don't want to give their social security number in order to sign up. Are there ways we can simplify this process, and why are social security numbers required?
Yeah, I can take that. The social security number is the link that we use with electronic health records. So when you register at the hospital for a procedure or we generate an account for you, it's all kind of linked in one account, so they're not broken up. We are, based on that fact, we know that there's a huge deficit with people's ability to either gain access to technology or to use that technology. So we were on a call today where we're working with a gentleman named Eric Woody from Beaumont, who's our community relations lead, to go ahead and work with our team to create some alternatives, especially for areas like assisted living or senior living, where not only may they have limited access to technology, but they also don't necessarily have the means to get to a point or to a center where we can give the vaccine. So we'll have some more to come on that. That'll be something that we can follow up on with the city for sure and get that information out. But we began talking about that today and trying to figure out a process to get that enacted for those people who are restricted in their ability to get to those sites.
Okay, thank you. Ann W. says, I am a healthcare worker, but am an independent practice. Since I'm not affiliated with the hospital, I have been unable to get the vaccine despite being in Group 1A. This is true for almost everyone I have contact with that is not affiliated with a hospital. My chart does not allow input of this eligibility factor. Can you address why this large group of healthcare workers are being left out?
I can, if the doctors want to add any to it, we're happy to try and help facilitate that. We've done that for a lot of our private practices or our family practice offices who do not come to the hospital proper. We have a whole process to go through. They're welcome to email me or call my office, and we'll get those instructions and the paperwork for them to fill out and faxed over from their offices, and then we can go ahead and get them scheduled. We just need to get that information from them, and we can help with that.
Yeah, there's one other source. I'll give a shout out to the Oakland County Health Department here. I mean, they basically have a online access where anyone who works at and or lives at or works for the Oakland County Health Department in any way will have availability of online registration for accepting a vaccine. The other is that they originally, when the state mandated for the 1A group, they took the lead and for the private sector of the healthcare industry to provide vaccines. So I have been in the past or recent past communicated with them, and they are of the same position we are in, which is that they have many more appointments or could appoint many more, but are limited in how much supply. So, but they are prioritizing 1A, and also the essential firefighters and police were on top of their list. And then they recently added the 65 and older category as well. So that's another methodology to get the privates into some vaccination program.
Okay. Karen L. says, in light of the fact that the new variations of the virus are more infectious and maybe less resistant to the vaccine, have there been any studies that found that people at least got milder cases if they actually came down with COVID after having both doses of the vaccine?
That is true of both the RNA vaccines, that there were some cases of mild cases that were found in the vaccine group there. And the latest published, I think, is much clearer with Moderna and also Novavax, which is another vaccine that's coming out. It's a recombinant adjuvant vaccine. And both of them have published their pre-EUA data, and both have illustrated that there are cases within their study group of mild disease, and that is in their data load for the approval process through the FDA. So yes, that is very possible. And anecdotally, though, we've been vaccinating our healthcare providers. I think we're vaccinating about, I think to date, we're about 56,000 doses or so provided to our own healthcare providers. And I have personally been contacted by physicians who literally have certain, or healthcare providers who've had circumstances where it seems to me that they have actually had vaccine almost coincidental to developing a new COVID infection. So it is interesting that there's a lot of derivations, but yes, it is possible to have, to get COVID even though vaccinated, fully vaccinated.
Thank you. Lee H. wants to know, will Beaumont offer vaccinations in Farmington Hills for senior citizens and the residents of Farmington Hills, I guess specifically? I think you talked about that already, but we can talk about it again.
Mike, do you know anything different from the vaccine committee?
So Beaumont at this time is trying to get to all the 65 and older. Eventually, I think they're going to be working with the state in terms of doing mass immunization, and that final plan has not come out yet. But I know there's talk, as you see all across the news, doing it at the TCF Center or doing it some mass area, but we don't know any final information on that just yet.
Okay. Will vaccines be available for children under the age of 16? How can the children in our community be protected?
So I guess I'll take that one too. The answer to that is that the FDA wanted more data on 16 and below. So even though some of the first two vaccines that came out had a little bit of data on that group, but in adolescents, there was not adequate for the FDA to go ahead and approve them. So they're going back, and the ongoing research for both those new vaccines, Pfizer and Moderna, are ongoing right now to not only include the adolescent group, but also to extend into the pediatric groups. So in children and infants and also children of school age, that is ongoing. And from what I've heard through channels, is that they should have enough data to get the first review done probably within the next 2 to 3 months.
2 to 3 months. Okay.
Mm-hmm.
Good. What percentage of the community need to get vaccinated to have herd immunity to COVID-19?
Yeah, that would be a distressing number. It's about 70 to 80% is generally the verbiage. So that would be combined natural immunity from actually getting COVID plus vaccinated immunization. So in order for that to occur, so literally if you depended on herd immunity to shut down a pandemic, you would have to achieve those kinds of numbers, which is why it really doesn't work in a pandemic to do that. So that's why we need the adjuvant of vaccinating all these people in order to get there.
Okay. Now, is it safe for women that are pregnant or breastfeeding to get the vaccine?
I guess I should talk about that one too, right? So the answer to that is that, of course, we don't have this great large body of work regarding it. However, we do have theory and at least some partial research available. So the part of this which I think is most reassuring has to do with the fact that both Moderna and Pfizer vaccines have very little in it if you really think about what it is. It's a packet of RNA combined in a tiny little particle of fat. And then the rest of it is either salts or whatever, salt and sugar dissolved in water. I mean, that's basically the vaccine. So if you just think about that, it is very benign in the sense of vaccines. The other is it's a packet of RNA. That RNA is really encoded to ask you, the host, to build the protein, the spike protein, which then challenges your immune system to respond to that spike protein. So you're actually making your own protein. And so the theory there is that it's very clean. It's not a viral particle. It's not an active. It's not a part of a coronavirus. It's not activated or attenuated or inactivated coronavirus even. It's just a very specific narrow window of making the spike protein. So now the national organizations, the ACIP, the FDA, as well as the OB professional organizations have all endorsed the vaccine for pregnant women. And the statement basically is you have to have a conversation with your OB to make sure that you have all your questions answered. But that's where we stand now. Of course, the ongoing evaluation and review by the drug companies and the FDA continues to monitor healthcare providers and others who are vaccinated who happen to be pregnant, and they will be continuing on to monitor that for safety. And I think that hopefully with all of that, we will reassure the population that it is safe in pregnancy.
All right. We have an email from Mark L. who says, initially we were told not to mix the two approved vaccines. Now the CDC is saying we can mix them. Has this been tested? Sorry, so many vaccination questions.
I know there's a lot of vaccine questions. That's okay. So this one's a quick one to actually is just to say one simple couple of comments. All this is that no, we are still supporting administering vaccine the way it was indicated and as the rollout and the FDA had approved the two vaccines. That conversation has to do with in a crisis situation where you're asking a large body of people to be vaccinated as fast as possible, then of course you may have to separate the vaccines and only even going down to one shot per individual now the conversation there is we wouldn't recommend it, but if you had an emergency or crisis where you felt that the benefits of doing that, either stopping at one per person and then doubling how many people you can vaccinate, or if you had to mix, is there a downside? And the answer is most of us believe, because both are RNA vaccines, that fundamentally there may be very little differences. And when you look at the immunogenicity of it, it may be okay. But it's not something that we're wholeheartedly endorsing right now.
Okay. If someone had a bad reaction, and we kind of talked about the reactions, is there a place to report that? Is there a local place to report that, or what do people do?
Well, this is the VSafe process, which is actually put together by the CDC, is actually a electronic way of reporting, and they are actually monitoring all vaccinated. So at Beaumont Health, for a good example, I mean, with your first vaccination, you were asked to download an app from the CDC, which is called VSafe. And what it does is it tracks you for daily tracking for a number of days, and then it flips to a weekly, and it's actually asking you for any of your symptoms. So that is coupled with hotlines that directly go to either the FDA, or you can choose to call Pfizer or Moderna themselves to report. And in the hospital, for example, there's already a healthcare provided a drug watch, a medication watch. So if you happen to have a reaction, severe reaction in a hospital, our pharmacists would actually report that for you.
Okay. So do you think, this is for anyone who wants to take it, that vaccine or vaccination proof will be required in order for someone to work an office job, like outside of their home? Is that something that's going to happen? Anyone know?
I think that's all going to be speculative,
Yeah.
what's going to come down, to be honest with you. Are they going to mandate it to travel? There's going to be a lot of things they may end up doing, with that.
Okay. And what do you all say to those that are kind of still against wearing masks?
Please wear a mask. You prevent, if you're a carrier, you may not be symptomatic. You prevent from giving it to everyone else. At least you reduce that chance. And by wearing a mask, you lessen the likelihood of getting a particle transmitted through the air to yourself.
Yeah. And I would just say, if you're also, hearing the news and listening to the news, right? So we're talking about like only about 7% of Michiganders are vaccinated at this point. We are so slow in this process that we are likely going to lose the race between the variants and vaccination. So basically the most important thing here, I mean, we'll do the best job we can. Obviously we have to vaccinate as many people as we can, Well, you have to fall back on what we know works, and that's masking and distancing and following all what we've been talking about for over a year now about how to stop transmission. It's distancing, it's masking. So I think that it's been proven over and over again. Now we know right now that the UK variant is in Michigan. You know, Washtenaw County is really having their struggles with it, and now we know for sure that there are major hotspots now located in California and southern Florida, and based on what we know about this whole thing, it's really about getting in your head that the transmission process can be halted if you wear a mask and someone else wears a mask as well. So it's basically a public health issue. It's not just about protecting yourself, it's protecting others. Again, going back to the whole process of this works, and it's proven that it works. So you just have to follow it.
Right. Now, I know some people say that, I remember seeing a question about the type of mask. But I mean, you basically are saying, even if it's not, perfect grade, it's better than nothing, right?
Right. So I think that you have to, I mean, I don't want to focus on the masking part, right? But if you are okay, so how I would think about it is, what is the risk factor for yourself? You're protecting yourself, right? So if you're at risk, one of the major risk factors for COVID, what I would say is, if you're afraid of getting COVID or even the variant in your community, but you have to go out, then I think that it's reasonable to really pay really close attention to the type of mask and how well it fits, right? So that's the key, is the type of mask and how well it fits. So if you were at risk, I would not be a person that I would be wearing a regular cloth mask that's manufactured by my relative, right? I would be using either a surgical mask, a KN95 or an N95, and then there's a call out to maybe double mask. But that's basically looking at making sure that you have the proper fit, right? So it's the intake and the venting of the mask, and that's key. So you can wear anything you'd like. It would be somewhat protective, but if it doesn't fit, then it's really kind of not very useful. So wear it properly and make sure it's properly fitted, especially if you're at risk. And then if you're the general public, it's really about more venting than it is. And again, it's wear it properly and make sure that it's fitted properly so that it contains your own droplets, before it's vented out into the public and filtered.
So what's one thing that our community members, that each person can do? Everyone's always asking, when are we going to get back to normal? What's one thing that they can do so we can get back to normal?
Yeah, it's just getting back to the public health recommendations, right? I mean, we'd hate to be repetitive, but we've been repetitive for quite a long time now. It's just following the guidelines, and it's just being aware of your surroundings nowadays and making sure that you're doing the appropriate thing. And since most of the transmission is by aerosol, it's really about that masking again. So the other things which are very supportive, and of course we need to do as well, is the hand hygiene. And I think what we've proven this year through the flu season is that vaccination and masking works. Because I'll tell you the statistics right now, in the entire Beaumont system since October, we've had like 4 or 5 cases of influenza documented. So that tells us that a lot of people got vaccinated because of the fear of COVID, but it also the fact that we distanced ourselves, we separated, we wore masks, and we scrubbed our skin clean. I mean, the hand hygiene. So that in and of itself proves that it works, right? So if you want to take a look at a sidebar benefit, it's the fact that we proved that masking and hand hygiene works very well, along with distancing, of course.
Yeah, that's an excellent point. Okay, I mean, we have a little bit of time left, but I'd like to go around to each panelist and let you, if I missed something, if there's something that you feel the community needs to know, maybe answer a question that you've heard in your own time, and just take it away, whoever wants to go first.
Well, I have an observation that we've encountered from the fire EMS side. Statistically, about 20% of our cardiac arrests that we respond to, where we start CPR, provide advanced life support measures, experience what we call ROSC, or return of spontaneous circulation. These patients are the ones that are not breathing, they have no heartbeat, but through our treatment, they regain that heartbeat and are then transported to the hospital. Out of that percentage, a certain number survive, are able to walk out of the hospital and lead normal lives again. Those events are certainly very rewarding to my staff. Conversely, we have responded to approximately 70 COVID-related cardiac arrests, and not a single patient has regained a heartbeat. These patients have also varied in age. We're seeing a lot of young patients that our staff is usually not accustomed to seeing, especially in cardiac arrest environments and situations. So I think that this reaffirms the seriousness of the virus and sometimes the deadly consequences of it. Maybe Dr. Reback could talk about maybe if those observations are normal that we're seeing.
Yeah, just to follow up, Chief, I think the two big takeaways from this are, one, continue to seek medical attention. It is safe. The one big thing that we saw during the spike of COVID back in the spring is that the amount of heart attacks and strokes that came into our emergency department were slim to none, realizing they're still out there in the community and people were just scared to come to the emergency department. And unfortunately, a lot of these people died in their homes. And I'm sure the fire department saw that, in a lot of cases, which was sad because we could have helped them. So the hospitals are safe, seek attention, even your routine care. We've taken all the precautions necessary at the hospitals. And the other part I would say is when you do have that opportunity to get vaccinated, take the vaccine. There are a lot of people out there that are fearful of it. As Dr. Fan mentioned, it is safe. Don't be scared, because that's one of our ways to obtain herd immunity so we can get back to normal. So really get the vaccine when you can. Those would be my two takeaways from this.
Lauren, I'd just like to add that if you look at our department, for instance, with our increase in run volume in March, April, and May, we came through as a department with nobody getting sick. I think that just points to that the PPE works if it's worn properly. You limit your exposure. I feel we're really fortunate during those 3 months. And I think it just stresses to the point of the recommendations from the CDC to wear a mask, to distance, and to limit exposure.
For me, I just would like to, thank our first responders. We're very fortunate, I think, in the Farmington and Farmington Hills area to have such a great team. They're great partners for us at the hospital, so a big thank you to them and to the EMS teams. I would just encourage people that if you're having issues and problems, I think to what's been already talked about, to not hesitate in coming to the hospital. We have, spent a lot of time and effort in having safe plans. We've always dealt with highly contagious and infectious diseases, just not in this volume. I think we're kind of pretty good at it now, not that we wanted to be good at it in the first place. And the hospital is very safe. I feel we're getting close to opening up and allowing regular visitors again, not whole groups, but an individual at a time. And, now that we're getting through this. So I just would encourage people not to wait. A lot of times, sometimes that ache goes away, but when it's chest pain or, other bigger things, we want you to get them checked out, because we don't want to do is sometimes we see people waiting until it's too late. And then the diagnosis is worse, or we have less of the ability to try to correct it or prevent it or improve it. So I just want you to know the hospital is safe. We really appreciate our relationship with all of you. And thank you for having me on tonight and our team.
Thank you for saying that, because I'm going to put my grandmother out there. Even, they're afraid to come to the hospital. So thank you for saying that. Dr.
Yeah.
Fan?
So I think that I would probably piggyback on that with a couple of different points that I don't think we got to. So one is about coming to the hospital, and everybody has brought to the fore that it's when the COVID pandemic hit, right? It was COVID fatalities, but we also had the incidental fatalities associated with people who had their ailments but never were assessed because they were afraid to come to the hospital. So that is really truly one of the reasons why we need to have people who are ill and who have all the coexisting factors that may put them at risk to come to the hospital, before we would have to tag our colleagues to bring them in by EMS, right? Get your treatments and get yourself evaluated back on the programs that will maintain your wellness over time. But in reference to COVID, though, remember we said a lot during the pandemic, don't come to the hospital when you're not sick, when you've got COVID, and please stay away. Well, the opposite is true now, right? So what we want to tell people is that if you have the diagnosis of COVID, especially if you have one of the risk factors for progressing disease, such as obesity, or if you're ethnically adverse, and or if you have hypertension and diabetes, even if you're feeling well, you should be assessed, because now we have monoclonal antibodies to provide you. So even if you don't get hospitalized, we can actually offer therapy for you. The others is don't wait too late. If you feel that you're having any respiratory symptoms, come to the emergency room. So allow us to evaluate you to make sure that you may not need to be admitted, because now, again, we have programs or treatment programs that are fairly standard now, and we can execute those. And we certainly, during this most recent pandemic through the fall, turned around a lot of patients who came to the hospital, but we discharged them very quickly within 5 to 7 days, unlike what we did back, in the spring, where we're keeping patients 1 week, 2 weeks, 3 weeks, 4 weeks, and maybe even sometimes 5 and 6 weeks at a time. Yeah. So we have seen a lot of progress in how we recognize, how we treat early, and all of our emphasis in therapy is now not to support the severe disease, but to also treat the mild and moderate illnesses, and we can successfully prevent them from going onto the ventilator. So come and be evaluated if you feel that you have COVID, and especially if you're not breathing well, make sure that you have a pulse oximetry at home and monitor yourself. And if it's less than 94%, come on in, because we have therapy for you. And the very last thing, which is always never gets really emphasized, is the fact that HMS, which is the hospitalist medicine safety network that is run by the state or a surrogate of the state and Blue Cross, and but we've been coordinating. Beaumont System has been coordinating with HMS, and we've provided them a lot of data on COVID patients through. We are the largest healthcare system with a number of COVID, providing them with data. And what we found there is that when you're admitted to the hospital but yet discharged, at 60 and 90 days, people are still not normal. A significant portion of them still have not come back to baseline. And a lot of those cases are what we call the long-termers. And those long-termers may be debilitated because of respiratory function, but there's also a lot of other non-specific kind of complaints where their attention spans are bad. They are also challenged in the way that they cannot get back to their normal activities. But even more importantly is there's a significant load now of depression and debility associated with that debility. And there is a lot of healthcare now expenses and dollars, very expensive therapies that are required, but yet no one can get access to them. But the state is monitoring that and looking at how we can put together comprehensive long-term plans for these long-termers. So these are, unfortunately, a lot of them were healthy and normal, but COVID has put them in this position. So,
and this is after they've tested negative, correct?
This is after they've recovered, fully recovered, and there's no specific COVID therapy for them. It's a matter of trying to rehab. And these are patients with lingering medical issues, and they're not getting back to their job. You've heard the term COVID fog and stuff like that. It's a very significant portion of the society now that's unfortunately suffering from these kind of minor symptoms. And that's also a very big piece that we seem to leave out. Everybody's afraid of the mortality part, but yet, you know, we have a significant number of the population, even after the fact, that are quite debilitated.
Yeah. Wow. Well, thank you all again for having this chat with us in this town hall. Fortunately and unfortunately, we may meet again soon because this, you know, these new variants keep coming up, and, you know, this is not just something that's stagnant, it's happening daily. But I feel more like I know more now about what's going on, especially in our community. And I feel like all of our questions have been answered. But if you have anything else you want to say before we sign off, please, the floor is yours. No, we're good. All right, well, thank you again, panelists, for being with us. And thank you so much for watching our virtual COVID-19 town hall.